So as we have discussed in the earlier class about the upper body in the appendicular skeletal system up to the wrist bones, the wrist and hand. So the next thing which we are going to discuss about, that is your lower body now, the lower pelvis, right, that we call the pelvic girdle, which comes. Now if I ask you that what are the different bones that forms the pelvic girdle? So sometimes people say only the hip bone is there. No, there are some other bones too that forms your pelvic girdle, guys. So still in the appendicular skeletal system, if we talk about the lower body, the lower limb. So in the appendicular skeletal system, so the lower limb, the lower extremities. So let's talk about the pelvis. So the different bones that forms the pelvis, this is the first question, what are the different bones that forms the pelvic girdle? So the three bones that we consider under the pelvis is the first we call sacrum, then the coccyx, that is your tailbone, and the hip bones. So these three categories of bones that forms your pelvic girdle. So if you look at about the skeletal system here now, so the whole pelvis, if I'm talking about, in the center if we see, right, in the center if you look at here, this is the sacrum. This is the part that is separated from the sacrum, that is your tailbone, right? And from the side you have two hip bones, right? The two hip bones, the whole which we say that this is the whole your pelvic girdle. So if you're talking about from the front part, if we look at here now, the hip bones are here now, if you see, right, the hip bones. And from the front if we go, the sacrum and the tailbone. So again, if we look at here now, from the back part of the body, sacrum is here, you can see easily, then the tailbone, and from the side we have a hip bones here, right? So the hip bones, that forms your pelvic girdle, guys. So these three bones that forms pelvic girdle. As we all know that the pelvis of male is narrower than the pelvis of female. The female pelvis is more broader than the male pelvis. Yes, so many reasons are there that what we can say due to childbirth, right? The organ is here, which is uterus over there. So that's why they need a space to deliver the child. So that's why the pelvic is more broader. The female pelvis is more broader than the male pelvis. Now people say this is whole. If we can see, this is the hip bone, right? The whole is the hip bone from here to here. So hip bone has also the parts, right? The hip bone is divided into three parts that we call the ilium, ischium and pubis. So the hip bone divided into three parts that we call ilium, ischium and pubis. So if you look at here now to the hip bones, the ilium, ischium and pubis. So these are the three different parts of the hip bones, guys. That forms comes under the pelvis also, and the hip bone divided into three parts: ilium, ischium and pubis. This is the largest part, ilium, right? Ilium is the largest part. So ilium occupies the maximum part in your hip bone. So now let's talk about the location of these three different parts on the hip bones. So if you look at here now, which you can see easily, like here, which you can see easily if you look at from the side view here, you can see this is the crest, right? That we call the iliac crest. And this whole part is the iliac. This is the largest part of the hip bone. From the front, from the side. This whole part is your iliac crest here. If I talk about the ischium, the middle part, if we can say this is the ischial tuberosity also here. So this is ischium. Then the base, right, the inferior part that we call the pubis here, right? That is your pubis. So ilium is the largest part here, then the ischium is the middle part here, and the pubis is the, what we can say, the base, right? The base of the hip bone. That is the ischial tuberosity here also. So ischium is here, and this sits bone, which we can say where you can find over there. So the base is the ischium, then the ilium is here, ischium is here, and the pubis is your this part, that is your base of the hip bone, the lower part of the hip bone. So as we have discussed, guys, in the which part of the lumbar spine, if you guys remember, we talk about the tilts, right? So the tilt we talk about in relation to arches. If you go back to your notes little bit for a while, and if you go to the lumbar spine, we have talked about the hypolordosis, hypolordosis, right? So hypolordosis and hypolordosis also does affect your tilt also. Like if it is going over here, this is the neutral tilt. If it is hyper, this is happening here. Like if I'm going here now, hypolordosis. So in which part my pelvis is moving? Anterior. If you look at from here, we are going anterior to the front part, right? Then we come to the neutral here, that is normal arch, yes. If you go to the posterior, no arch. So three types of tilt which we have here, that we call the anterior, posterior and neutral. So tilt with the hip bones, with the pelvis, tilt in relation to pelvis. So three different types of tilt: anterior, neutral and posterior, right? So three different types of tilts. So if you look at here now for the tilting, so anterior, if I'm neutral here, right? If you place your index finger on the front part of the hip bone, if you place your index finger on the front part of the hip bone, this one, and the thumb on the back part of your hip bone, that is we call the ASIS, the anterior superior iliac spine, and the back part we call posterior superior iliac spine. So if the anterior tilt is going over here, your index finger goes down and the thumb goes up, right? If you look at from the side view, this is neutral. My index finger and the thumb is on the same line. But if the anterior is going here, my index finger goes down, thumb goes up. Neutral in line. Posterior, here we go. If the thumb is going down and my index finger goes up. So neutral, anterior, neutral, posterior. So easily you can check with your students, guys, as you stand up over here, you can check where the pelvic level is going. If it is going forward, arch, high arch. You have to ask the client, just tuck your tailbone in or engage your abdominals, right? Engage your abdominal muscle. Or just you can give a simple example, just take it back from here. So this is neutral, you can check. My index finger, my thumb is in one line. If it is going forward, anterior, my index finger goes down and my thumb goes up. Neutral, one line. Posterior, this is no arch. So index finger goes up, thumb goes down. So these are the three tilts that we can check with the person in relation to your alignment too in yoga poses, or into the neutral aspect of your life too, guys, how we are standing, how we are sitting. So in the standing, mostly we work on this level like this. In the sitting, mostly how we sit over there now, mostly sitting like this. So it is going posterior more. In the standing, working on this frontal plane more, it is going anterior more. So be careful that as we have discussed earlier into the alignment classes too, anterior we need for forward bending. Neutral we need for standing postures. And the posterior we need for backward bending. If you see, I am going forward bending, anterior tilt I need. Standing, if this is happening, muscle imbalance. Standing, I need neutral, right? Neutral. Posterior, if you have to go, first rotate your pelvis back. So posterior pelvic tilt and then go for the backward bending. So anterior needed, my dear friends, for forward bending, neutral needed for standing postures, and the posterior needed for the backward bending poses, guys. So be careful and always remind in your mind which tilt we needed for each categories of postures. So now, guys, if the person asks like pelvis, we know that the pelvis has been formed by sacrum, coccyx and hip bones. Then the hip bone divided into ilium, ischium and pubis. Then anterior, neutral and posterior tilt. Hip joint. Where is the hip joint is situated? Sometimes people say this is the hip joint. As we have discussed earlier, now this is pelvis, right? This is pelvis. Hip joint, if you see, this is the front part of your bone, right? This is the front part of your bone, hip bone. If you go slightly downwards from here, 1 inch, 2 inch and 2.5 inch, and you find some head of the humerus, that is the head of the femur bone. So head of the femur here, and that attaches to this socket. So hip bone or hip joint, if you have to find, you just check your front part of the hip bone, go slightly down, 1 to 2 and then 2.5 inch over here, and you find if you rotate like this way, you feel that your head is moving in and out. If this is we called external rotation of the hip, internal rotation of the hip. External rotation of the hip, internal rotation of the hip joint. So you can see from the front and slightly lateral side is my hip joint, right? So hip joint, if we talk about, so this is the socket of the hip bone. So this is the socket of the hip bone that we call acetabulum, right? That is the anatomical name of this socket, acetabulum. And in this socket, your head of the femur, that is your thigh bone. So that is attached here, right? So this is the femur, thigh bone, that is the longest bone in the body, right? The longest bone in the body. So here we can say that where does it meet? The socket and the head of the femur. This part we call the hip joint, right? The hip joint. So now, as we say, the problem nowadays, guys, the hip tightness, the less hip opening, right? The anatomy of the hip, you can see socket attaches to your head of the femur. Here we can see also this socket, right? This socket, this is the socket, and the head is attaches to the socket. Which bone is this one? Femur. The thigh bone, longest bone in the body. So here it forms the hip joint, this movement that happens here. So mostly nowadays, as we are more civilized to the chair jobs, my friends, so what happens, how we sit over there now, you say that my hips are not opening, problem with the hip opening, right? So mostly how we sit, sit with the closed legged, right? The closed leg position, legs together. So what is happening? Internal rotation of the hip. Then after that you need more comfortable, so you do that way. You're crossing your legs. So what is happening here? Internal rotation of the hip. And we can say, guys, as mostly in the West, we guys are not prone to sit on the floor. Mostly when you eat the food, you eat on the chairs, like on the dining tables, you're working on the chairs mostly. But it's very less that you are sitting on the floor. Because if from here, I'm working like this way, we never allow our legs to go like this, to create some space. I never say that do like this way, but we can do like a slight movement, not like this way. You can do slightly hips shoulder apart and do this in between, right? This ankle rotation, ankle external rotation, or we can say outward rotation of the ankle, and you can feel that you are creating some space on your hip joint. Why I'm explaining, guys, this for you? Because so many structures, right? So many structure in between this head and socket. So many structure. You have a ligaments, you have flavum here, ligamentum flavum is here. You have a cartilage, right? You have a synovial fluid. So many structure comes in this area. You have a tendons, right? So if you are not allowing any space here, and this is happening, nowadays that's why more prone hip surgeries, the hip replacement, because of our poor postural habits, right? Poor alignments on sitting and the standing, and not creating enough space and not creating enough stretching. So blood circulation is impaired there, and automatically it leads to the degeneration of the tissues, right? The degeneration of the tissues. So sometimes tightness in the ligaments, muscle tightness we have a tendon injuries over there, right? Cartilage destruction that we call the arthritis of the hip joint. That is most common nowadays in the earlier ages because of poor postural habits. Food and nutrition has also plays an important role. What level of calcium, what type of calcium we are eating here. So guys, that's why I'm asking you that if I'm sitting here now, right? And if I'm sitting like this, can you feel any space? If you sit like this way right now, you cannot feel any space, my friends. Then after that, if you feel like this way, just feel. This is not only compressing your hip, this is also creating pressure on your lower back. See, shoulder is going around it. So one misalignment can cause the misalignment to other parts of the body. So that's why as we go on to sitting on the floor, like this is the way, you can see how much space I can create, right? How much space I can create here. So this is easily happening, like I'm doing the external rotation first, I'm taking here now, I'm going here now. That's why you go when you're doing the butterfly pose is what we say, hip opening, right? So if you have a sitting jobs, like for 6 hours, 8 hours, if you have a standing jobs too, so never ever forget about, my dear friends, to do these stretches for 3 minutes, 5 minutes, 7 minutes, 10 minutes a day. And try to practice to sit on the floor. That is the easiest way to bring the muscle memory in your brain, which you haven't used since a long time, to open that muscles, right? To release that muscles and to create some space between your between your socket and your head of the femur, that is your thigh bone. If you are doing the stretching completely, if you are sitting like this way, if you are doing balancing, counterbalance, more blood circulation will be there. And rather than the degeneration of tissues, there will be the regeneration of the cells and tissues. So I hope guys this must be clear to you that where is the hip and where is the pelvis. So hip joint is here. This is the hip joint. There is no hip joint, right? And the pelvis is the whole pelvic girdle. So make sure, be clear about that. Where is the hip? Which movement comes from the hip and which movement comes from the pelvis. So tilt always come from the pelvis. Flexion of the hip always come from the hip joint. Extension come from the hip joint. Abduction come from the hip. Adduction come from the hip joint. So be careful about that. I hope this must be clear to you, and always find the difference, where is hip and where is pelvis. So till then, enjoy. Namaste. See you in next class.